Hello everyone, this is Dr. Cherie Pettit here, and I'm going to briefly talk to you about why exercise needs to be in healthcare. In 2009, Dr. Stephen Blair published an article in the British Journal of Sports Medicine. Low cardiorespiratory fitness was the greatest risk factor for all-cause death when compared to obesity, smoking, hypertension, high cholesterol, and diabetes for both men and women. In 2016, the Centers for Disease Control reports 1 in 4 U.S. adults are not active. Susan Carlson and colleagues in 2015 published data indicating that 11.1% of healthcare expenditures were associated with inadequate physical activity. It's clear we have a problem. While prevention is important, we must remember that physical activity is also an important adjunctive therapy, especially for breast cancer survivors. In a 2005 article in the Journal of the American Medical Association, Holmes and colleagues reported a relative risk of death from breast cancer was 50% less in those walking 3 hours per week in almost 3,000 breast cancer survivors. Just stop and think about that for a minute. If there was a drug that reduced your risk for death by 50%, would you take it? Would healthcare professionals prescribe it? If these data are true, you have to ask yourself an important question. Why are there not exercise professionals in every cancer center in America? If we turn to look at diabetes, we hear a similar story. The Diabetes Prevention Program Research Group published a paper in 2002 in the New England Journal of Medicine. Their data indicated that type 2 diabetes incidence rates decreased by 58% for those making dietary changes and increasing their physical activity when compared to 31% for those on the drug metformin. Yet when a person is diagnosed with type 2 diabetes in the United States today, no standardized referral is made to an exercise professional. If we turn to look at depression from Cooney and colleagues in 2013, you see similar results. Exercise was shown to be just as effective as antidepressant treatments in reducing levels of mild to moderate depression. As we continue to move from a fee-for-service model to a value-based care model, it is becoming more and more clear that it is time for exercise professionals to partner with healthcare providers and make exercise the first prescription we recommend.